It was scary to worry if a seizure is gonna come. I was on at least 6 anti-epilepsy medicines with maybe 3 or 4 like supporting medicines you need to take with it. Side effects to those was anxiety, depression, weight gain, hair loss. I didn't know that there were options like VNS.
I saw Maryam when she was around age 18. Her epilepsy has started in her early teenagers, and by the time she came to my clinic, she has been tried on multiple anti-seizure drugs. But the problem was that the anti-seizure medications were not controlling her seizure.
I ended up in an emergency room and I met a doctor there who learned about VNS therapy. He told me, I think that this is something that could possibly help you. And so we began the process of contacting the company and having a nurse case manager come in who told me all about the device and how it worked, and that it was not a cure, but it was a way to help me manage my seizures.
One of the first experiences I had with the vagus nerve stimulator was in, a young man whose seizures happened both during the day and at night, 3 or 4 times per month. It impacted his ability to work for a lot of reasons. He had to take days off, and on the days after the ones that happened at night, he would need to stay home basically to recover from his seizures. So he was missing anywhere from 4 to 8 work days per month. After the vagus nerve stimulator was put in, he wasn't seizure-free, but his seizures decreased to about 1 every other month. Now, you got to think about this because the difference was up to 8 days per month of work off, now down to 2 days of work every other month. And so his work and his ability to get back and forth to work changed dramatically.
It was just one setback after another because again, you're looking for, at that time when it came to the medication, you were looking for a solution that was going to stop the seizure activity, but then you'd hit these roadblocks, or she would hit these roadblocks of having some type of a reaction, and they were broad. They were anything from a skin reaction to hair loss, to memory loss, to having to grasp for words and not knowing words. And I can tell you, she's in public relations, and her ability to speak clearly and have her thoughts right there and ready, that was difficult for her.
Having the seizures and then being diagnosed with epilepsy affected my parents because at first, when I first started having seizures, they were hopeful that they would stop, but as they continued to get more frequent and more intense, they realized that they were not stopping, and so my ability to hang out with my friends, to do sleepovers, was completely stopped for a long time.
Her neurologist was very informative and let us know that this could be a way to get her back into her quality of life being increased, getting her back into school, getting her back into her activities again. And so we said, okay, let's go for it.